Hey there, future dental pros. Today, I've got something super exciting for you. Tackling complex tooth infections like a pro. We're diving into persistent infections and the complex anatomy of teeth. So let's get straight into it. First up, let's talk about those stubborn infections that just don't want to go away. Persistent infections can be a nightmare, right? The key here is thorough diagnosis. Use your radiographs and CBCT scans to get a detailed look at the anatomy. Remember, infections can hide in the nooks and crannies of the root system, so don't just rely on the 2D images. Go for that 3D perspective. Now, once you've identified the infection, it's all about cleaning and shaping the root canals effectively. Irrigation is your best friend here. Use solutions like sodium hypochlorite and EDTA to flush out those bacteria. And don't forget to activate your irrigants with ultrasonic or laser devices for that extra kick. Next, let's talk about the anatomy. Teeth can be tricky with their complex root canal systems. Take the mandibular molars, for instance. They often have extra canals or unusual curvatures. Always be prepared for surprises. Use your endodontic explorer to feel for additional canals and employ magnification tools like loupes or microscopes for better visibility. All right, let's move on to obturation sealing those canals for good. Gutta percha is your go-to material, but how you place it matters a lot. Use techniques like the warm vertical compaction or continuous wave to ensure a tight seal. This prevents any future infections from sneaking in. And here's a pro tip. Always check your work with a post-treatment radiograph. This ensures your fillings are placed perfectly and there are no voids. Now, sometimes you'll encounter cases where traditional methods just don't cut it. In such scenarios, consider surgical options like apicoectomy. Removing the tip of the root and sealing it can save the tooth. Lastly, don't forget patient education. Inform them about the importance of oral hygiene and regular checkups. A well-informed patient is likely to follow your advice and maintain their dental health. So there you have it. Managing complex tooth infections is all about precision, patience, and using the right tools. Keep learning, keep practicing, and soon you'll be handling these cases like a pro. If you found this video helpful, give it a thumbs up and subscribe for more dental tips and tricks. Thanks for watching, and I'll see you in the next one.